Hi guys, my name is Jamil and today we will discuss about the apoptosis, the next topic of the cell injury. So these are the things that we will discuss in apoptosis, very long, very large subject is this. First we will discuss about the definition and number two we will discuss about the difference between necrosis and apoptosis on the surface, and then we will discuss why we need apoptosis pathologically and physiologically, why we need apoptosis, why our cell must go apoptosis, and at the last we will discuss about their molecular mechanisms, extrinsic pathway, intrinsic pathway, cytotoxic seed plus cells pathway, and finally into a common pathway. So first we will discuss about the definition. What is the definition of apoptosis? Programmed cell death or suicide by using energy itself. So it is that apoptosis is programmed cell death. It is being programmed. It is a suicide of a cell. This is a suicide of a cell or programmed cell death of the apoptosis. But in this case, energy will be used. So it is an active process. In this case, energy will be used. So what is the definition? Definition is that this is the suicide of the cell, and in this process, energy will be used. This is just simple definition of apoptosis. But what are the reasons that irreversible? What are the these physiological? Why we need this? Why we need apoptosis, and what are their molecular mechanism? What changes takes place? We will discuss it deeply right now. First, we must know that. Now we will discuss about the difference. What is the difference between necrosis and apoptosis? The first difference is that on the base of stress. On the base of stress. Apoptosis. Here I read apoptosis, and here necrosis. So, difference between apoptosis and necrosis. First one is that apoptosis, in this case, stress will be both pathologically and physiologically. Both stress may be pathological plus physiological. Both stress will cause the physiological stress. So both stress will cause the apoptosis. But in case of necrosis, stress will always be the just pathology. So here stress will be the pathology. This was the first difference between apoptosis and necrosis on the basis of stress. Second is inflammation. In this case, inflammation will occur, but in apoptosis, no inflammation. Why? Because you know that in case of necrosis, this is a cell, and what happens to the plasma membrane in case of necrosis? This cell membrane will be ruptured. When membrane will be ruptured, then these enzymes will come out. When enzymes will come out, then these cause inflammation. Because these enzymes act on the other cells, so they destroy also other cells. Now in this case, group of cells will injure. Group of cells will injure, and this is the inflammation. What happens? In this case, plasma membrane will rupture, enzymes will come out, and they will act on the other cells, and group of cells will be injured, and this is named as the inflammation. So in case of necrosis, inflammation occurs. But in case of apoptosis, no inflammation. There is just shrinkage of the cell. There is the shrinkage of the cell. Like that, this is a normal cell. When apoptosis will take place, this cell will be shrinking first like that. After that, after shrinking, why it is the cell will become shrinking? Because material present in the apoptotic cell will be shrink. Material will be condensed. When material will be condensed, then shrinkage of the apoptotic cell will happen. And after that, it will become apoptotic bodies like that. It will become apoptotic bodies. Apoptotic bodies. And then these apoptotic bodies will be engulfed by macrophages, and we will discuss that this mechanism, why apoptotic bodies are being phagocyted by macrophages. We will discuss it later in this lecture. So what happens here? It will cause shrinkage because it will condense, and it will become apoptotic bodies, and these apoptotic bodies will be engulfed by the macrophages. So in this case, no rupture of the membrane, so no enzymes will come out. No enzymes will come out. When enzymes will not come out, so they will not disturb to other cells. When other cells will not disturb, then it means that in this case only one cell or single cell will be disturbed in case of apoptosis, or maybe small group of cells. But in case of necrosis, group of cells will injure. First point was that stress, second is that shrinkage, and here is the rupture of membrane, inflammation, and third is that in this case one cell or very small group of cells will be injured, but in this case group of cells will be injured. So this was a little bit difference between apoptosis and necrosis. So the next point is that why we need apoptosis. Why we need apoptosis? First we will discuss physiological for our benefit. First we will discuss the physiologically why we need apoptosis. Look at this, embryogenesis. During embryogenesis, when our hand will form during embryogenesis, development of hand is like that. This is the development of our hand during embryogenesis. This is our hand. But what happens? This is something like that, something like hand. But during this embryogenesis, there will be some case of autophagy. This is our hand, and between the fingers there will be the mass. Where we have to suicide these cells. We have to suicide these cells. So these cells will be suicided, and like that it will become the fingers like that. One, two, three, four, five. So 5 fingers will form, and these cells will undergo apoptosis. These cells will undergo apoptosis during embryogenesis, and our hand formation will be completed. And second example of embryogenesis is that tubes, like that. When first tubes will form, tubes are like that. These are just like that, a rod, like that, a solid rod. There is no space between these tubes. These are like that. This is rod, and there is no space. And what will happen? Then here will occur the apoptosis. Apoptosis will occur in the center of these rods, and so now these will produce space between them. So there are nothing cell in the center. So now it will become the tubes. So it was the physiological case why apoptosis occurs in case of embryogenesis. First hand and second is tube. So second thing is a hormonal withdrawal. Example of the breast cells and endometrium. Let's suppose that some hormones are missing. In physiological cases, when there is no production of hormones, less hormones, then hormones to which cells which are being stimulated by these hormones will come to apoptosis, will come to suicide. They will finish. Why? Because there is no hormones to act on them, so there is no function of these cells, and these cells function will go towards the apoptosis. I would like to give the example. Let's suppose that first one is the breast cells. In case of breast cells, during pregnancy, what? During pregnancy, what happens during pregnancy? During pregnancy, the prolactin hormone will decrease. Prolactin hormone will decrease. When this prolactin hormone will decrease, then what is the function of prolactin hormone? Act on the breast cells to produce milk. But during pregnancy, there is a less production of prolactin. When prolactin will not produced, then it will cause the suicide of the breast cells, because no function of breast cells. So breast cells will undergo apoptosis and no production of milk during pregnancy. Therefore, during pregnancy there is no production of milk, but after after the birth, after the childbirth, then prolactin will increase, and again the mitosis and breast cells will form, and it will cause again activation of milk production. Also another example, endometrial. Let's suppose that in case of menstrual cycle, when bleeding, why bleeding takes place? In case of bleeding, endometrial cells. When there is no fertilization, no fertilized egg, no implantation. When no implantation, then clearly does mean that progesterone hormone will decrease. Progesterone will decrease, because what is the function of progesterone? The function of progesterone is to maintain the implantation, but this time no implantation. When no implantation, then this hormone will decrease. When this hormone will decrease, then no function of endometrial cell. When then no function of endometrial cell, then these endometrial cells will come to suicide or apoptosis, and it will cause the bleeding. So it is because that endometrial cell shows the bleeding. It was the second case. Third case, forced suicide to the cells, like that in case of thymus. What is this he is saying? He is trying to say that, let's suppose that this is our thymus. And what is the function of thymus there? Its function is that when here will come the T cells, lymphocytes, and it will cause the maturation of T cells, and it will gives out. So it will cause maturation of T cells. So T cells will be maturated. But sometimes what happens? When T cells come inside the thymus and thymus mature them, but during this process in the thymus, these T cells, in this T cells, some antibodies will form. It will give autoimmune response. Autoimmune response. It produces the antibodies against its own. So it will produce these antibodies. So now this T cells will be dangerous for our body. Dangerous for our body. So to avoid these dangerous T cells, then these T cells will undergo apoptosis and it will be finished. It will be a suicide or programmed cell death of T cell. What happens? T cells will come in the thymus. Thymus will cause maturation, but sometimes autoimmune response will happen and it will form antibodies against its own self, against its own body. So it is dangerous for body. So apoptosis will happen and it will come to suicide. So it was in discuss of forced suicide in case of thymus. What next point? Next point is excess cell production. Sometimes more and more cell production. To avoid the cancer, we undergo the apoptosis. Examples are the bone marrow. In bone marrow, more production of red blood cells, but we need small amount of red blood cells in our body. So small amount of red blood cells will undergo apoptosis and small will go to the blood. What? Bone marrow cell basically produces more and more red blood cells, but we need small amount of red blood cells in our body. So small amount of red blood cells will undergo apoptosis process and they will be finished. Second example is GIT. Also in case of GIT, there are cells. In GIT, they produce cells again and again. So if apoptosis not occur, then this GIT tract will become close, and it will cause infection. It will cause the blockage of these GIT. But in these cells, apoptosis will occur and they will finish. So this GIT will remain smooth. Third is about skin. In case of skin, also there is a more and more production of cells. If not apoptosis will take place, then it will increase, further increase, and it is not good for health. So what will happen? These cells will undergo apoptosis and these will finish. So skin will remain again at its normal state. So these were the physiological. First one was embryogenesis in case of hand, I give the example, and also tube. Second is hormonal withdrawal in case of menstrual cycle also, and in case of milk production, breast cells also undergo mitosis. Third is the forced suicide. Example is this thymus like that. Sometimes produced its antibodies against its own cells. Autoimmune response. So we need to go these T cells which are autoimmune response, which gives autoimmune response. We need to these cells to undergo apoptosis. The fourth one is excessive cell production in case of bone marrow. Bone marrow produces more red blood cells, but some are being undergo apoptosis and some are in the blood because we need small amount of red blood cells in the blood. And second is over that. In case of GIT, in GIT also there are cells that produce more and more cell production. If these cells did not undergo apoptosis, that will cause the closeness of the GIT tract. Also in second, there is more production, so we need to go the cells into apoptosis. So these were the physiological need of apoptosis. Next is pathological. What are the causes of apoptosis? Pathological. Now we will discuss about pathological causes. In pathological, the first one is genetic material injury. Let's come here. Let's suppose that genetic material in our body and radiations come at them. When radiations attack on the genetic material, then this genetic material now is being injured. And we have to then this cell have to go under apoptosis. Otherwise, this injured cell may go necrosis. And can cause inflammation and cause the death of also other cells. So avoid this necrosis. Avoid this necrosis and avoid this inflammation. No, look at this. This is a pathological because it is an extra cause, external step. This is the radiation comes attack on the genetic When dying on the genetic material may be injured. If this genetic material did not go apoptosis, then it will cause necrosis, and necrosis can cause inflammation. So you know inflammation is more dangerous for us, for dangerous our body. So to avoid this necrosis, these injured cells will undergo apoptosis. So this was the first pathological cause of apoptosis. Second is viral infection. Same like that. Let's suppose that this is a tissue, and inside the tissue there are some microbes. These are the microbes, and when these microbes attacks on these cells, and they will cause some infection. In cell, and this infected cell will undergo apoptosis. If it will not go apoptosis, again same process will cause necrosis and inflammation. So avoid this necrosis and inflammation. These viral infected cells will undergo apoptosis. Its third cause is glandular infection. What is this glandular infection? Sometimes let's suppose that this is a gland, pancreatic gland. Let's suppose that this and this like that, something like that. These are the lobes, and here is the production of hormones, and they release from here. But sometimes what happens? Here will be the obstruction in the. Here is the obstruction in this tube. When there is an obstruction, then these cells will normally produce. Hormones, but these hormones will not move outside. When these hormones will not move outside, so they will be accumulated here. When they are being accumulated here, they can cause infection. To avoid again necrosis and this inflammation, these cells will undergo apoptosis again, to avoid this necrosis and inflammation. So this is the glandular structural infection. What happens? There may be the block, so hormones, the glandular production will be accumulated. So where they will accumulate, these cells have undergone apoptosis, otherwise it will cause necrosis and inflammation. Next is the p53 action. So first you must know that what is the p53 action. In case of DNA replication, like that, this is a DNA replication. So during DNA replication, there may be the mutations. And what is the function of this p53? This here is the p53 present here. When p53 recognizes that there is a mutations during this DNA replication, then this p53 will stop the cell division. It will stop this DNA replication. He will stop this DNA replication and will cause the repair into normal. Case. What happens? What is missing? That when there are mutations in the DNA replication, then p53 will recognize these mutations and he will stop this DNA replication and will cause the repair. But sometimes when this is repairing is not being taken, then what he will do that these muted cells will undergo again apoptosis. If these muted cells not undergo apoptosis, then it will again cause the necrosis and inflammation. To avoid that inflammation, these cells will undergo apoptosis. Basically, p53 is a very deep topic. We will discuss later and pathology. So this is about the pathological need of the apoptosis. What was that? First was genetic material injured. When genetic material injured, to avoid necrosis, it will undergo the apoptosis. Viral infection, same that in viral infection, to avoid necrosis, it will go apoptosis. And glandular infection, I have also discussed that, maybe the blockage. So avoid from necrosis, it will go the apoptosis. p53, I have just explained that in case of p53 cells, they have to go apoptosis, otherwise it may show the infection or it may show the necrosis. So